Hello friends, I am Dr. Vikram Jaggi. I am the Medical Director of Asthma, Chest and Allergy Centers, New Delhi and Gurgaon. These are premier centers relating to asthma and allergy, and we are doing this work for 25 years. Patient care, diagnosis, treatment, research, publications, etc. And today I am very briefly going to talk about what are the common myths and misconceptions which actually become hurdles for patients in their getting okay. Asthma is not difficult to control. Most asthmatics can be absolutely normal, and to my mind, the one of the biggest hurdles is the myths and misconceptions which asthma patients have, which keeps them from getting the benefit of simple effective therapy. That's the bottom line. And why does this happen? When the disease is chronic, is there, and it is felt that the treatment for that is forever, this concept is not palatable to the patient. If it is diabetes and blood pressure, even though it's not palatable, it is easily digestible, and the patient very easily starts taking the medicine, at least for diabetes. But for asthma, even though it's a chronic condition and requires similar kind of an approach, the patient is looking everywhere, trying to try everything possible under the sun so that he can achieve that elusive cure. So, advice from Dr. Google, advice from internet, advice from well-meaning but not sometimes very fully informed relatives and friends. That concoction sometimes creates myths in the minds of asthma patients, and which becomes a hurdle. What are those common ones? One, asthma is all in the head. It's a psychosomatic disorder. Absolutely wrong. It's in the air tubes. The air tubes are very twitchy genetically, and they will constrict because of a variety of stimulus and reasons. So it's not in. No doubt, some asthmatics' emotions play some role. It's not a major role. Two, it's an infectious disease. It can be given to one from another. My wife has asthma, I could also get it. Absolutely wrong. It runs in the family, no doubt, but that's a genetic thing, not from one to each other. Fortunately, these two things are becoming less of a myth nowadays because people are reasonably aware about these things now. It used to be a big problem earlier. But the number 3 and number 4 are still a big problem, and that is relating to inhalers. Inhalers are habit forming, they are bad, and inhaled steroids are bad and they can have side effects. Let's take them one by one. Inhalers are habit forming. It's a very negative way of looking at a thing. My eyes are weak, I can't see clearly, I must use glasses to see clearly. I am myopic. Now I can also say that this is now become a habit. Since that day when specs were given to me, now I can't see without specs. It's become a habit. It's very bad. That's not the correct way to look at it. My eyes are weak. This is a solution. I put on glasses. I can see. An asthma patient has got asthma, full stop. Something has to be done, and that can be effectively and safely done through the inhaler. When that solution is applied, the benefit is there. When it is not applied, you will not get the benefit naturally. When I remove my glasses, then I should not complain that now I can't see. Everybody knows I can't see without specs, and I can see with my specs. So they are not habit forming, they are a need which is being fulfilled by them. Inhaled corticosteroids, which are there in some of the inhalers, are very, very safe actually. They are safe for pregnant women, certified. They are safe for children, they are safe for Olympic athletes. These are 3 groups where safety certification is not given easily, so they are very safe simply because of the fact that they go there and they are not absorbed in any significant quantities, so they are safe. Another common myth is that asthmatics should avoid sports. No, they should get their asthma under full control and then do whatever sports they want, and that is possible, 100% possible. There are n number of examples of Olympic athletes, cricketers, footballers, not naming them, who many people know that, which those are, and they are at the pinnacle of their sporting glory in spite of the fact that they have asthma. All they need to do is to control their asthma and then do whatever they want to do in sports. And the last one myth is that this is applies to children, that if a child has asthma at say 4, 5 or 6 years, the pediatrician or the doctor or any family members will say, don't worry, the child will outgrow it. Children do outgrow asthma. A majority do actually. 55% of the boys eventually will outgrow their asthma, 45% of the girls will outgrow, but not all. It's about 50%, not all. So one can't simply hope that it will go away. It goes away in some and it doesn't. There are ways and means to help in that process of that you can outgrow it. I will discuss some other time. But yes, not all asthmatics outgrow their asthma. So if these myths are kind of removed from the minds, the asthma reality is clearer to the patient and he accepts the therapy of that more readily and gets the fullest benefit of it. Thank you very much.